Mr Brumby, Sue Dunlevy from the Daily Telegraph. You're saying today the title of your address is Putting Patients First, but it's not something that you're doing in your own hospital system. Victoria's hospitals see fewer emergency and elective surgery patients within the recommended time than hospitals in New South Wales. You spend $123 less per patient than New South Wales. Your hospital system provides fewer beds per 1,000 people than New South Wales, and your hospital performance has been going backwards for 5 years. Why should you be regarded as some kind of authority on health? And why should patients in other states have to put up with a second-rate system because someone who can't run his own health system is behaving like a bully?
Sounds like somebody might have written that question. I know. Can I just say in relation to those matters, it's been acknowledged through this debate by lots of commentators that Victoria runs a good health system. Some have said that we run the best health system. I've not made that claim, but others have made that claim. The biggest thing that holds our health system back is a lack of federal funding. I can't be clearer about it. You know, that's what's happened. That's what that graph. I don't know if you saw that, the Jaws graph. That's what it shows. It shows that we used to put in an equal amount. It shows the Commonwealth's been cutting its funding. So we can do much better in emergency departments if we got more funding from the Commonwealth. We can do much better in terms of elective surgery if we got more support from the Commonwealth. And indeed, last year, we did agree with the Commonwealth in a $60 million elective surgery package. And by the way, if you want to test of Victoria's achievements in elective surgery, we treated under that national program last year more than half of all of the additional elective surgery treatments across Australia. And finally, a question about we spend less per head. Well, one of the things I've learned over the years in public life is the test in this business is not what you put in, it's what you get out. It's about the efficiency of the system. That's the whole point. You wouldn't have a debate about health if you were proposing let's run the most inefficient system in the world where you just throw money at it and you couldn't care less about the outcomes. So it is true that per head of population we spend less. We spend less because we generate more, because we are the most efficient public hospital system in Australia. And why are we the most efficient? We're the most efficient because we've got local health networks, because we've got activity-based funding, because we've got our hospital admissions resource program, because we're tackling preventative illness in the workplace through work health. All of those things drive efficiencies. And this is the challenge. This is the challenge across Australia, to produce an efficient system. And to be fair to the PM, that's what he wants to produce across Australia. You know, when you think about it, activity-based funding and LHNs, that idea came out of Victoria. So it came out of Victoria because the Prime Minister presumably thinks we do those things well. But we should be driving for an efficient system. That's what we've got in Victoria. But in terms of treating more patients, the only thing, the biggest single reform, let's be clear about the biggest single reform you could make to our hospital system. The biggest single reform for the Victorian hospital system is more federal money now.